Welcome back to TV5 News at 9. Now, May is Brain Cancer Awareness Month, and today we are talking about a treatment for brain cancer with McLaren Proton Therapy Center. Joining us this morning is Director Dr. Hisham Gayar. Thank you so much for being here this morning.
My pleasure to be with you. Thank you for inviting me.
Yes, you are always welcome, Doctor. Now tell us how proton therapy is beneficial treatment for brain tumors. How does that treatment work, and where could tumors be in the brain?
Proton therapy is actually an excellent radiation when you're treating the brain or organs close to the brain. As we all know, the brain is the most important structure in the body and has many eloquent centers that can be affected even with very low doses of radiation treatment. And because of that, any radiation you spare to normal brain tissue away from the tumor is very important. Proton therapy is subatomic particles that stop at the target designed and does not exit into normal tissue. So when you use the proton therapy, you are sparing about 70% of unnecessary radiation to sensitive structures in the brain. And the brain is full, of course, of many sensitive structures. I'm going to share a screen with you to show you what I'm talking about and how the brain can be saved. So if we look here at this screen, this is a normal radiation, the conventional radiation, treating a tumor at this location here. And as we see, there is a lot of spell radiation, even with the best technology, IMRT or rapid arcs. There is a spell doses of radiation to the entire brain, lower than the target, but it does affect the brain negatively. Red here is the high doses, and blue is the lower doses. While if we use proton therapy in the middle here, you can treat the target. And the majority of the brain is spared any radiation, that is zero radiation. Any brain cell receiving radiation will have damage. And this is the difference. This is what you spare when you use proton therapy, is this third picture here, where this is unnecessary radiation you avoided when we use proton therapy. And this is equal to about 450,000 dental x-rays that we worry about when we go to the dentist. So if we are talking about critical structures and we're dealing with patients and humans that need quality of life after treatment, after curing the cancer, you need to have good quality of life and less side effects. Proton therapy will help achieve that by avoiding the normal brain tissue receiving unnecessary radiation and keep the radiation only where it belongs, at the tumor, at the target, because it's very precise. Subatomic particles that stops at the target gives most of the radiation, 70 to 80%, where it belongs, and minimal in the way coming in and zero exit. That allows for protecting normal tissue, not only for brain tumor treatment, but for any cancer close to the brain. So when we're talking about throat cancer, eyes cancer, nasopharynx cancer, cancer of the tonsils, cancer of these are all structures that radiation can, conventional radiation, the regular radiation, goes crossing the brain, the base or the skull into the brain tissue. But with proton therapy, you avoid all that. So any cancer in the head and neck is safer when you use proton therapy, simply.
You know, I love the fact that you brought us this graph today. I'm a very visual learner, so seeing that is actually just fascinating, Doctor. Now, I might have included this question in my first question, so you might have missed it, but you know, if somebody is concerned about brain tumors, where do those usually end up in the brain? How can people really find out about it?
Well, unfortunately, brain tumors, when they make symptoms, the symptoms can be significant because of how critical the organs. And all brain tumors is different. Some tumors are found accidentally by an MRI or a CAT scan, like meningioma. And whether it's benign tumor or malignant, whether it's low grade or high grade, they all benefit from proton therapy. Actually, the longer the survival, the more important to spare normal tissue, the better the proton therapy is compared to conventional radiation. But to find out about brain tumor is, if you're having any symptoms, don't hesitate, contact your doctor and see if you can have imaging to show if there's any concerns. Change in mental condition, focusing, ability, vision, hearing, tinnitus, sounds that are not appropriate, inability to walk, unsteady gait, and so on. Weakness in part of the body, different sensations in part of your systems. If you have neurological symptoms, don't ignore it. Go to your doctor. And if you have a brain tumor or suspecting one, explore proton therapy for your treatment before you start getting conventional radiation, just to protect your brain. It is of much value.
Absolutely. It's one of the most important organs of our body. Now, doctor, this seems like proton therapy is the future. How can people learn more about it?
You can reach us through the McLaren website and learn about the Proton Center, or call us at 855-MY-PROTON. And we will be glad to share information, educate you, and even remotely we can discuss the case and see if it's worth it for you to come and visit, or it's not necessary. Just find out if it's an option for you.
Absolutely. Doctor, is there anything else that you wanted to add, maybe you didn't get a chance to say yet before we go?
It's basically, having cancer is not as tonsillitis or infection. It's a serious treatment. So before you proceed with treating cancer, find out your options. Check and see what's the best option for you. Read, learn, and we'll be glad to help if you think we can help in that process of finding out. If you have a neighbor or a friend or a family member with cancer, let them know, because sometimes people proceed with what they have available without exploring the options.
You're right about that. Well, doctor, we appreciate you being here with us again this morning. Certainly learned a lot here today.
Thank you very much.
Absolutely, my pleasure. And of course, you can find more information about this topic in the hot links section of WNEM.com.